In the earlier part of this program, we had tried to show the relation between science and yoga and also shown a few case studies to prove that yoga plays an important role in the cure of diseases. In this part of program, we shall be dealing with a few other diseases and the role of yoga in them. A study was done on a group of rheumatoid patients in Great Britain at the South Cleveland Hospital. Autoimmunity is considered to be the cause of rheumatoid.
The mind, stress works on your immune system and brings about lot of depression or inefficiency of the immune system, works on the joints and produces fighting. Unnecessary fighting against our own body tissues, which really should not have happened. After all, our immune cells has to fight only against the enemies from outside. But because they have no better business and they are all restless, agitated and tense, they go and attack our own body cells, thinking that they are foreign. What a dangerous situation.
The results were quite encouraging, as the group who performed yoga saw a considerable reduction in the quantity of drugs to be consumed daily, and also the capacity to hold the grip had also improved quite considerably.
Doctor, you have talked previously about the role of yoga in pulmonary tuberculosis. So can you emphasize about some...
This was a very interesting study that we took up. We went to sanatoria where patients are isolated because they are producing lot of TB germs even in their sputum, and they will become infected to the society around. Therefore, they are kept away until their sputum negativity is achieved. So, such people, 48 of them we studied, and in the age group of 20 to 55, and they were all having the same type of sputum positivity. They had had no prior treatment and they were all coming for the first time for treatment, and we added yoga to these people for 2 months. They were practicing for 1 hour, and we made various types of assessments, and we proposed 2 possibilities. The possibility 1 is where they are producing lot of infective germs and they become totally nil after 2 months, and another possibility where there is no change. And we noticed that the group who had practiced yoga had improved much faster. The possibility 1, that from high infectivity to nil infectivity, was 76% in the yoga group as compared to the non-yoga group, where it was only about 50%, showing that their sputum negativity or the germs can be fought away much faster if we can strengthen their immune system. Their body weight increased much more rapidly in the yoga group as compared to the control group. The possibility that the grade 3 to grade 0 of the radiographic changes, the X-ray changes, had been achieved much faster in the yoga group as compared to the non-yoga group. So that is what we say, that when a person practices yoga, even when he has pulmonary tuberculosis, their lung capacity improves, they reduce their infectivity much faster. And how could this be achieved? This is what we say is the concept of psychoneuroimmunology, where the mind can influence our immune system to fight away the germs much faster by reduction of the stress, by becoming very deeply rested inside, and that is what is the concept of yoga in even as infective a disease as tuberculosis.
Another study was conducted at the Kidwai Research Memorial Institute, Bangalore, where it was to be found out as to what effect does yoga has on these 40 patients of uterine cervix. It is said that even a healthy body manufactures a few cancer cells, and if the body is normal, then the immune system is strong enough to pick up these cancer-prone cells and then destroying them. Going back to the research study, the daily feedback reports were collected from these patients to find out the common side effects of radiotherapy. This group was doing yoga for 30 to 45 minutes daily. It was seen that the symptoms of acute bowel complaints had considerably reduced in the yoga group.
I'm reminded of a lady who went through this intensive radiotherapy for which she had to be isolated inside a room. She had kept cassette records of all the various yogic techniques. She would just put on the cassette, lie down and keep on doing it all day. It is a total isolation. It's almost like isolation in a cell. And she came out and said, I had a beautiful retreat inside these 3 days rather than going through this intense, terrifying experience of being isolated, going through all the side effects of the radiation. So that's how a positive quality of life has been shown to be achieved in large number of people with cancer.
Now, we shall be showing you a few of the methods of doing yoga, as well as the logic behind these yogas.
In fact, we have been able to use many special techniques in various diseases. Let us see this technique called chair breathing, which we use in the management of acute attacks of asthma. Here, the subject is seated with the support of a chair. In fact, this we developed when the person was having an acute attack during our classes, and the nearby chair was pulled out because it is only in that position that the person is more comfortable when he is having intense wheezing, and he hangs on to the handle of the chair and starts breathing comfortably, slowly as he can. We know that he is having intense fast breathing, and the person is continuously given instructions of breathing in slowly as the head goes up, breathe out as the head goes down, and this goes on continuously and at the speed that he can. In the management of back pain, it's very important to see that we avoid any forward bending. So the person lies down on his back and starts doing what we call as folded leg lumbar stretch. Both the legs are folded up and stretched laterally so that the person can feel the stretch in the painful area of the back, and this being very harmless for the back. The person can do this about 10 times combined with normal natural breathing movements. The back is moved and person is asked to concentrate intensely on the point of the back. After doing about 10 times, the person goes on to practice another back pain special technique called Setu Bandhasana lumbar stretch, where the legs are folded and the waist is lifted up as the person breathes in, and the waist comes down as the person breathes out. Apart from all the practices that we did, Dhanurasana, the bow posture, is one of the very useful practices in the management of diabetes. Hansasana, in which the person lies down on the abdomen and takes all the weight of the body on the elbows, which is stuck into the abdominal wall, and the legs are stretched back. So in this position there is intense pressure on the abdominal organs, and it is said in the yogic text that this may help in releasing the insulin from the pancreatic cells, and certainly it does increase the blood flow to the pancreas. Whether there is more insulin that is formed or released has yet to be observed scientifically. Let me now show you some of the practices that we use in the management of rheumatoid arthritis, which involves all the joints, lot of painful joints, and so to release the stiffness in the joints, the person starts doing slow but persistent, continuous, stable movements of the different joints. We may start with fingers and then go on to wrist movements. So in the wrist movements, we can do the forward, backward and rotation of the wrists also, about 10 times each one of these movements. Then one goes on to move the shoulders, shoulder rotation. Every joint is given the possible movements. Whatever the person can do, the person goes on doing to the possible range also. We don't have to overforce or work intensively, but gradually the stiffness gets released when one does it with an attitude of ease, comfort, and starts putting the mind with eyes closed on the point that is painful, on the joint that is getting released, and then at the end of it drops down the hand and relaxes the part completely. Let me show you some very simple practices that we use in people who have high blood pressure or even have had heart attacks. Heart attack people have enormous fear that any physical movement may strain them, and therefore they have also been advised not to do it, and we also do not want to overstrain their hearts. So we teach them many practices like Shavasana and Pranayama. Shavasana is a very useful technique in which the person lies down, and one of the very useful technique that we use is called quick relaxation technique, where the person lies down flat on the bed and starts observing the movement of the abdomen. As the person breathes in, the abdomen comes up. As the person breathes out, the abdomen goes down. And this abdominal movement is deepened, and the person starts doing very deep abdominal breathing in a very, very comfortable mood. And this gives enormous relaxation. And this can be done within just 2-3 minutes several times in the day by people who have hypertension, because it is the bad habit of our arteries to get into spasm and the BP tends to go up. So the persons with hypertension and heart problem are advised to practice this several times in the day whenever they get free time, before food, after food, any time they can practice this. You notice that in all this, there is this basic component of relaxation, calmness of mind, stabilization, ease, rest, etc., both to the local parts and to the entire system.
Madam, the patient of any age group can practice these asanas?
Yes, in fact, we have been able to teach yoga to people of all ages. In fact, we say from womb to tomb, yoga can be of great help. We have had some research where the mothers, when they practiced yoga, the baby in the womb also gets a lot of benefit as observed through blood flow changes to the baby and all that. But generally, it is understood that a child at the age of 10 years starts doing the practices if they are normal, healthy children. But we will be able to use many simple practices even in younger children.